Live now to Queen's Park, where Liberal MPP Adil Shamji is discussing escalating ER wait times and closures.
It's not just because this same problem has played out predictably and worsened year after year under Doug Ford. It's because on December 6th, 2023, the Auditor General of Ontario released a perfectly timed report on emergency departments that delivered a scathing analysis of this government's mismanagement and presented concrete, actionable solutions just in time for the winter respiratory season. And when that report was released, instead of taking accountability for that mismanagement, the government instead chose to adjourn the legislature early and to answer no questions. To every Ontarian, patient, caregiver, and healthcare worker struggling to access healthcare today, Doug Ford's indifference, inaction, and incompetence leading up to and following that report is the reason that we are here today. It is the reason that critically ill babies who should be seen in an emergency department within 15 minutes are instead getting seen in 5 hours. It is the reason that emergency departments are closing right now, such as Chesley, Walkerton, and Durham just last week, amongst many others. It is the reason that wait times currently are through the roof. Now, the Auditor General report delivered alarming findings. It said that ER wait times under Doug Ford have increased by nearly 35%. That 23% of visits to the emergency room were for less urgent or non-urgent care altogether because people struggle to access home care, primary care, and long-term care. And it said that between 2022 and 2023, there were 203 emergency department closures, representing 5,092 hours of absent service. And of course, this continues to worsen. And these statistics mask the magnitude of the individual suffering. For example, when ERs close, people with strokes, heart attacks, and sepsis simply cannot get access to care, even though every single minute counts. It means it leads to the epidemic of people choosing to leave the emergency department against medical advice, rather than enduring long wait times. It means missed and delayed diagnoses, resulting in worse health outcomes. And it means increased, unnecessary deaths that arise because of excessive wait times. Welcome to Doug Ford's Ontario. Now, the Auditor General made 14 concrete recommendations designed to help with the exact scenario we face right now. And at a time when the province needs leadership to implement those solutions, the government's response has instead been to run and hide. They didn't just run and hide from accountability when the AG identified and warned of those issues. They strategically timed the adjournment of the legislature to eliminate any accountability and any scrutiny in the wake of those findings. And this continues. The Premier and Minister of Health are nowhere to be found currently, entirely absent, and offering no leadership whatsoever to navigate the crisis that we're in. Ontarians need hope, they need health care, and they need solutions. And this is why today I am calling for the Minister of Health and the Premier to come out of hiding and to stand where I am standing to outline their plan to immediately reduce and eliminate ER closures and ER wait times. This plan must include their acceptance of all of the Auditor General's recommendations and an update of what steps they have taken to implement those solutions since they were released over a month ago with this exact scenario in mind. For those that haven't read the report, those 14 recommendations include actionable items like expanding urgent care centers, restoring public funding to virtual urgent care models that this government dismantled, addressing exploitative temporary for-profit nursing agencies, and maximizing support to timely primary care access. They must also deliver a healthcare worker retention strategy that is based on addressing the challenges that healthcare workers are facing right now, such as workplace violence and their epidemic levels of burnout, moral injury, and demoralization. And of course, this means paying them fairly and abandoning the pursuit of appealing Bill 124. They must also ensure that primary care, home care, and long-term care are fully funded and accessible to patients. Yet we see quarter after quarter that this government underspends on healthcare by billions of dollars. Those funds need to be unlocked and invested immediately. And finally, I expect them to deliver public health messaging, literally any public health messaging, that can help Ontarians stay safe this winter and to understand their options of how to actually access care in the right place at the right time here in our province. With that, I'm happy to take your questions.
Doc, you're pretty good at pointing the finger and playing the blame game, even though...
Well, we've been listening to Liberal MPP Adil Shamji discussing escalating ER wait times and closures and taking some shots at the provincial government about the system, about what's going on in our healthcare system.